Welcome everyone, and thank you for joining us for today's electronic billing state level debrief for workers' compensation, an essential guide to the e-billing clearinghouse climate, including the New York State Workers' Compensation Board CMS 1500 initiative. Today's presentation is presented by Carisk Intelligent Clearinghouse in collaboration with Medata and the New York State Workers' Compensation Board. Before we get started, I would like to quickly go over some logistics. We ask that you please submit any questions you may have through the chat feature here on GoToWebinar. We will have 2 opportunities throughout the session to cover questions, so anytime you have a question, please feel free to send it in using the chat. Also, this webinar is being recorded and we will post it to our Carisk Intelligent Clearinghouse blog and our YouTube channel for future reference. Please note that this presentation, along with additional resources, will be provided via email to all attendees following the session. We'd like to ask that you please complete the post-webinar survey to provide us feedback on future topics. You will receive the survey via email following the presentation. And at this point, I'd like to pass it over to Sally to get us started.
Thank you, Paige. Good afternoon, everybody. Today, on our presentation, we will be covering an introduction of our presenters, a number of state mandates with a heavy focus on the New York Workers' Compensation CMS initiative. Because I'm sure, as all of you know, the New York State Workers' Compensation Board is impacting the national adoption of this standard for electronic billing in workers' compensation, which has lagged behind the industry for many, many years. After our section on the New York Workers' Compensation CMS 1500 initiative, we are fortunate to have a representative with the board here to answer your questions directly. Upon completion of that Q&A, we will cover some additional states and their updates on electronic billing, and then a brief overview of our clearinghouse services with a final Q&A at the end. To start, I'd like to introduce myself. My name is Sally Baglioni, and I have been with Carisk Partners for 3 years, and I oversee the sales operation for the Clearinghouse division. I am the liaison for clients with our internal stakeholders, and I have over 20 years sales experience in product and software sales, customer service, and new business development. Prior to joining Carisk, I worked for several of the top publishing organizations in the country as director or vice president of sales. And I have a master's degree in business administration from Monmouth University. Next, we'll have Vincina Annuzzi. Vincina has been with Carisk Partners for 9 years, and her current position is Director of Implementation and Product Strategy. Vincina oversees all of the clearinghouse operations, including implementation, development projects, and customer service. She works extensively with key stakeholders, including our software vendors, providers, carriers, state insurance funds, and the New York Workers' Compensation Board. Finally, as I mentioned, we are fortunate to have Stephanie Zufali here with us today. Stephanie has over 28 years of employee benefit experience working for various New York State agencies, including the Workers' Compensation Board, the Department of Civil Service, and the Division of Budget. Currently, Stephanie is the Director of Regulatory Affairs and Risk Management at the New York State Workers' Compensation Board. Prior to New York State, she worked for 5 years as a certified public accountant for KPMG LLP in the government, banking, and manufacturing sectors, as well as individual and corporate taxation. Stephanie has her BS in accounting from the University of Vermont. Next slide, please. Vincina will start us off with the role of the clearinghouse in the e-billing space and then present the details on the New York Workers' Compensation 2021 initiative. Vincina?
Thank you, Sally. So the role of the clearinghouse in electronic billing. The clearinghouse is the intermediary between submitters of bills, which are providers, billers, etc., and the receivers of bills, insurance carriers, state boards such as the New York Workers' Compensation Board, and state insurance funds. Our clearinghouse is able to ingest bills in a variety of data formats, We process the data, scrub the bills clean, and translate the bills into whatever data format the receiver requires. A key component of what CIC handles in this process includes the attaching and export of supporting documentation with every bill. Next slide. We're going to give an overview of various upcoming state requirements, as Sally stated, beginning with and focusing heavily on the state of New York, specifically relating to workers' compensation billing. I'll be presenting a lot of information to you regarding both provider and payer requirements. Throughout this segment, you will see many links incorporated within the slides for your reference. You will find additional resources pertaining to New York requirements in the appendices at the end of this slide deck, which will be disseminated to all. Following the New York segment, we'll break for questions, after which Sally will continue. Next slide. The New York Workers' Compensation Board initiative involves mandating the use and electronic transmission of the 1500 form and EOBs with the intention of increasing provider participation in the workers' compensation system by simplifying and streamlining the billing process. Toward this end, the 1500 form will be used in lieu of all other professional workers' compensation forms in New York, with the exception of the C43 form, which is the permanent impairment form. The 1500 form is currently an option already, but will be required in lieu of the other forms by July 1st, 2021. This slide includes a link to the 1500 initiative overview on the Workers' Compensation Board website. Next slide. So what does the mandate require of providers and payers? Providers will need to electronically submit 1500s with supporting documentation to payers and to the Workers' Compensation Board. The 1500 data must be submitted to the Work Comp Board, specifically in XML format. Providers must connect to an approved XML submission partner in order to accomplish this. Providers must also register with the Workers' Comp Board to get into the board system as approved for electronic XML submission and are urged to do this as soon as possible. On the payer side, this means that payers must be equipped to accept bills and supporting documentation electronically. It does not need to be in XML format, and payers can partner with a clearinghouse vendor to achieve this. Payers will also need to send electronic acknowledgments of the receipt of bills, including the date of the receipt, and will need to send EOB information back to providers electronically as well. Again, payers can partner with a clearinghouse vendor in order to accomplish this. CIC, as remarked in the beginning of the presentation, is able to facilitate all of the above to achieve compliance for both providers and payers. The Workers' Compensation Board does not anticipate granting waivers to these requirements for either providers or payers. If providers do not submit 1500s electronically come July 2021, their bills can be found legally defective, which affects payment. Next slide. So diving a little deeper into these requirements on the payer side, payers must be prepared to follow the New York fee schedule and guidelines laid out by the board's expanded provider law, the link to which is included in this slide. Payers will be required to use the C81 and C84 forms with applicable CARC codes, claim adjustment reason codes. Included in this slide is a link to the Workers' Compensation Board's standardized CARC codes, which must be utilized. The EOB must also be provided electronically to providers or to your clearinghouse partner, who will then disperse the EOBs electronically to providers on your behalf. The EOBs must contain the same CARC codes as utilized on the C8 forms. Next slide. Now delving deeper into the provider requirements, all providers rendering professional services in New York, with the few noted exceptions, must be board authorized with a board authorization number and rating code. As mentioned previously, providers must also register for electronic XML submission. We include a link herein to the registration page. It's a one-time process required by the board, which entails completing registration on the website and the execution of a legal agreement provided by the board, which must be returned, signed, and notarized by the provider. Once these prerequisites are completed, the provider will be able to submit 1500s with attachments to the work comp board in XML format via an approved XML submission partner, such as CIC. Next slide. This slide gives an overview of the board's recent expanded provider law, which expanded the types of providers who can now become board authorized and will also be required to submit 1500s electronically come July 2021. We also offer some granular information pertaining to workers' compensation billing on the 1500 form as prescribed by the board for provider and payer reference, such as what modifiers should or should not be used for certain bill types. Next slide. Now, the next few slides are going to give an overview of what's entailed in becoming an XML submission partner to the New York Work Comp Board. So to start, legal agreements must be executed. Then all of the programming must be completed to translate bill data into XML format according to the board's specifications. In addition, programming must be completed to map the bill data as specified by the board onto an image of the 1500 form. And the board is very specific about what data elements they want in which fields of the 1500, and these include non-standard data elements such as the provider workers' comp board authorization number and rating code, and the workers' comp board case number. Next slide. Prospective partners must then complete extensive multi-phase testing with the board prior to gaining official approval. Next slide. So the good news is that CIC has completed all of these necessary requirements and is already an approved XML submission partner to the board. CIC is handling the mapping of data behind the scenes so that submitting providers do not need to modify their current submission process. CIC will convert the data to XML per board specification and transmit it to the board, while also converting the bill data to whatever format the payer requires, whether that's X12 837 or some other electronic format. Next slide. We include a link here that we strongly encourage all stakeholders to visit in order to subscribe to Workers' Comp Board emails for regular updates regarding the resources we include in appendices to this presentation. And those include updates to FAQs, requirements for payers and healthcare providers, board bulletins and reminders, future webinars, and more. Next. So with that, we are now going to break for questions, which can be submitted via the chat feature. And Stephanie Zufali from the New York Workers' Compensation Board is here to field any questions that you might have.
Thanks, Vincina. I have a couple questions that I will read aloud now. Okay, the first being, what information will a payer be required to submit to the XML submission partner upon receipt of a CMS 1500 bill?
Good afternoon. This is Stephanie Zufali. So thank you for that question. The payer must submit the following information to an XML submission partner. The first is the insurer acknowledgement date. So in other words, the date that the insurer or payer receives the CMS 1500 bill electronically from the clearinghouse. They also need to send their insurer W number, as well as the Workers' Compensation Board case number if the case is assembled. As in, if a first report of injury has already come to the board and we have set it up or assembled it as a case, there will be a WCB case number associated with that.
Thank you, Stephanie. The next question is, if a payer has no claim on record for a specific injury date, is it required to accept a CMS 1500 from an XML submission partner?
So yes, so in the case that I just mentioned a minute ago, even if there is no first report of injury on file, the payer is expected or required to accept that CMS 1500 from the XML submission partner. I will caveat that unless it's clearly an error and it's, you know, there's no policy on file, it's clearly the wrong insurer. So, but if it's just a matter of a CMS 1500 bill comes in for a claimant for a policy that is underwritten by the insurer, but there's no claim on file yet, it still needs to be accepted by the payer.
Great, thank you. The next question is, will the CRC for denial codes replace the C84 and C81s, or will a payer be expected to complete both?
So for I'll say an interim time period, there will be the requirement for payers to complete both the EOB, which will be sent electronically to the providers and will contain the CART codes to let the provider know what the objection reasons are. And they will also need to complete the C8.1 or the C8.4, which have matching CART codes and objection reasons. So for some time period, both will be needed. Eventually, we plan to discontinue the C8.1 and the C8.4. But before we can discontinue those forms, we need to be able to obtain the CART code information electronically from the payers. We expect that that is going to roll out as part of our onboard initiative, but it won't be before 2023.
Great, thank you. Okay, the next question is, as a third-party administrator who handles claims for self-insured employers and insurance carriers, will our information be captured anywhere on the CMS 1500?
Yes, third-party administrator information will be captured on the CMS 1500 in item 0, which is where the payer name, address, city, state, and zip code information resides. Also, if known, the carrier's W number should be entered in that same item 0.
Okay, great, thank you. The next question is, will all payers be required to accept the CMS 1500 electronically?
Yes, all payers are required to accept the CMS 1500 in paper form today, and will be required to accept it electronically when it becomes mandatory in phase 2, which is will be July 2021. Payers should currently be in the process of implementing electronic acceptance of the CMS 1500 from one or more clearinghouses.
Great, thank you. And then lastly, to piggyback off of that, actually, what steps do I need to take now to be ready for phase 2 and 3 of the CMS 1500 initiative?
So payers should be working with an approved XML submission partner to ensure that they're ready to accept this electronic CMS 1500 submissions. On our website, we have a link to all of the XML submission partners. There are currently 4 approved, including Carisk. There's another 8 that are in some stage of the testing. In addition, payers should be working with their medical bill review companies to crosswalk any current objection reasons that they use to the mandatory CARC and RARC codes, the claims adjustment reason codes that were mentioned earlier. as these will become mandatory to be used in July 2021.
Awesome, thank you. Okay, that concludes all the questions for now. Just as a reminder, if you have any questions throughout the remainder of the presentation for the Carisk team or for Stephanie, please put those in the chat function and we will get to those at the end. And thanks so much, Stephanie.
Oh, you're welcome.
Okay, and now I will pass it over to Sally to take us through the remainder of the presentation.
Thanks, Paige. As Vincina mentioned, we have incorporated links to the specific state information presented here. We will also give you a link to the state-by-state analysis of e-billing mandates that's located on our website under resources for current updates. What's most concerning to many payers and providers is that the national regulations for electronic billing continue to change. These changes are at the state level, which creates a lot of criteria that has to be adhered to by the stakeholders. The good news is Carisk Intelligent Clearinghouse understands all of the state-by-state level requirements and is equipped to receive and process your bill in every state across the nation correctly for the highest level of efficiency and success. Next slide, Paige. In California, the key point to understand is that payers are required to accept all electronically submitted bills, but that this is an optional process for providers and submitters. As California anticipates initiating some rulemaking action to update the regulations in the coming months, we would recommend anyone doing business in California to subscribe to the Division of Workers' Compensation mailing list so that you can receive timely updates on what's happening in the state of California. And that link is here. Next slide. In the state of Florida, medical bills may be submitted electronically, provided that the insurance carrier agrees. The largest carrier that Carisk Intelligent Clearinghouse has a direct connection to in Florida in the no-fault category would be Geico, and that just came live this past year. Currently, there are no proposed rules to require electronic billing submission in the state. However, again, we would recommend a connection to the Workers' Compensation Division so that you could get up-to-date information on anything happening in the state of Florida. Next slide. In Illinois, currently, every submitter rendering treatment based on the Illinois Workers' Compensation Act must submit a medical bill for payment, but can do so either electronically or on paper, provided that the submitter uses the standardized form. We are not aware, again, in Illinois that there are any pending legislation changes to electronic submission in Illinois, but that bills can be submitted electronically should the submitter want and should the insurance carrier allow. Next slide. Colorado does not require but allows electronic billing when it is mutually agreed upon by the payer and the provider. For claims that are submitted electronically, providers may prove timely filing by showing the payer acknowledgement that the claim was accepted. Colorado does update their rules annually, and we stay in touch with them as to what's happening each year. Next slide. Since the fall of last year in New Jersey, electronic billing with required supporting documentation was made mandatory for both workers' compensation and auto in the state of New Jersey for all healthcare providers submitting more than 25 bills per month. Receivers in New Jersey must acknowledge receipt of the completed electronic medical bill to the submitter, and the submitter can use their acknowledgement as proof of submission. The one thing that we found in New Jersey last year, as we came closer to these mandate requirement dates, the influx of both payers and providers to get themselves compliant was increased dramatically. So our hope with these and some of the other webinars that we'll be presenting on New York is that payers and providers prepare early. We can't stress that enough. There were many people left at the end of the line in New Jersey last year because the volume of people who were not ready was vast. So the more you can do to get yourself ready in New York this coming year, the better off you will be. Next slide. In North Dakota, the Workforce Safety and Insurance Division will be implementing an EDI billing requirement effective July 1, 2020 in the state of North Dakota. For any medical practice submitting greater than 50 bills a year, they must submit both the bills and the supporting medical documentation electronically through Carisk Intelligent Clearinghouse. And we will be having some webinars after the first of the year specific to the North Dakota compliance requirement. Next slide, please. In Minnesota, for over 10 years, the state has required that all group purchasers must accept and all healthcare providers must submit electronic claims and eligibility transactions between submitters and receivers under the Code of Federal Regulation. Additionally, in 2012, it was required that an electronic acknowledgement when receiving health care claims be provided. So Minnesota has been in it for a while and requires the process to happen electronically. Next slide, please. Now we're going to jump into some capabilities for the Clearinghouse specifically. Next slide. We provide an end-to-end solution for error-proof claim submission and processing that is easy to use with medical documentation attachment capabilities, as well as virtually no wait time for processing. Next slide. Our next generation technology specializes in the processing of work comp and no-fault auto e-billing for flexible, compliant, and efficient processing. Our clearinghouse can be customized to integrate with any software platform being used by a submitter and tailored to any payer's needs. We have been processing workers' compensation and no-fault auto bills for over 20 years, and we are the largest submitter of bills to the New York Workers' Compensation Board and have worked very closely with them on this new initiative for 2021 to ensure your success. Next slide, please. Carisk Intelligent Clearinghouse is an easy-to-use, tech-enabled solution which simplifies the administrative burden, saving your team time with manual intervention on processing bills, because in the next slide, you'll see we have a 97% first pass clean claim rate for error-proof submission. We provide simultaneous claim and medical record attachment solution, pre-submission notification, and direct payer acceptance acknowledgement, ensuring error-proof submission, claim verification of the submission within 24 hours, and free storage of all medical bills and records. Next slide, please. This system is easy to use and easy to enable. For payers, it requires a usage agreement, and for providers, it's a simple enrollment. And it's a simple transition. Change for some people is never easy, but the system allows for hands-on and very user-friendly applications. Once the connectivity is established and EDI testing is completed, both payers and providers can go live with provider adoption support for payers, which is supported by the CIC sales team. Next slide. Finally, to learn more about the process, you can contact me with the contact information provided here, and we can provide you with a customized demo of our system capabilities for your business process. Now, we're going to jump back to the final Q&A. I'll hand the presentation back to Paige if anyone has any questions about the clearinghouse capabilities, state mandates, or the New York Workers' Compensation CMS 1500 initiative. We will take them now.
Thanks, Sally. We had a couple New York specific questions come through, so I'll go through those now. The first being is, will the New York Workers' Compensation Board require providers to submit reconsiderations electronically, or can they still submit via paper?
So my understanding is that there is a line on the CMS 1500 regarding reconsiderations or resubmissions. I believe that we have the rules for resubmissions on our XML matrix that's on our website, but I would like to get back to you afterwards. I'll get the response to Carisk, and they can get it out to the folks viewing this presentation.
Thank you, Stephanie. And I want to point out that the link to that matrix that you just referred to is included in the slide deck as well.
Okay, great. Thank you.
Thank you both. Another New York specific question is, are there timely payment rules when a carrier receives an e-bill for New York like there is with a California e-bill?
So there are requirements as far as the payer's requirements to timely process the bill. It needs to either be paid or objected to within 45 days. None of the rules regarding timely processing of bills are changing as a result of this initiative. But the one thing that will now be incorporated if the bill is disputed is that we will be using that acknowledgement date, which is one of the required pieces of information that the payer sends back through the clearinghouse to the provider and to the board. We'll be using that acknowledgement date as the date that will start the clock ticking for that 45-day requirement.
Great, thank you. Another question that came through is, are hospitals required to submit facility fees, UB04s, on CMS 1500 forms, or will they continue to submit UB04s? If so, can a provider submit a UB04 electronically, and is Carisk able to accept those forms electronically?
So I'll take it from the New York side. The initiative that we're rolling out for CMS 1500 does not extend to facility or institutional bills, so those can continue to be billed in the same manner that a facility or institution uses today, which may be the UB04. I'll turn it over back to Carisk. If you have a way of electronically receiving those and sending them along, that's great, but we do not have a specific schema, XML schema, that would capture facility bills.
Mm-hmm. Thank you, Stephanie. Carisk is able to process UB04s, and as Stephanie said, this XML initiative is for professional bills, so they would be on the 1500 form, but the institutional bills would be billed on the UB04, and Carisk is able to process them, and we in fact do have another connection to the Work Comp Board. It's not being sent in the XML format, as Stephanie stated, but we are able to submit PDF images, copies to the board, as well as send them electronically to payers. We can also print and mail UB04 forms to payers who are not yet able to receive them electronically.
Thank you both. And then just a more general question is, does this initiative apply to me?
So I'll take that page. So if you are a provider who is working in the workers' comp arena, it will apply to you. So that would include physicians and podiatrists and physical therapists, occupational therapists, licensed clinical social workers, psychiatrists. It will also apply to other types of folks providing services in the workers' comp arena, but who are not authorized to treat, that they're not formally authorized by the board. So for example, dentists would be submitting the CMS 1500 and they can sign up for the XML submission. Audiologists can sign up, optometrists, as well as DME vendors. Also, providers who are working out of New York State, who are, do have some patients and are treating them for a workers' comp related accident, they may also send in their bill on a CMS 1500. And if they would like to sign up for the electronic submission, they may also do that.
Okay, great, thank you. Another general question. As a provider, what is required in the supporting documentation that I send?
So on the board's website, we have many examples of properly completed CMS 1500 documents. So that would be the face of the CMS 1500. And in addition to that, we have examples of the components of the narrative attachment that would accompany, say, a physician's bill. Some of the key information that would be on top of what a doctor might typically have in their narrative is that we require the causal relationship, the work status, and the temporary impairment percentages to be included at the very, front of that narrative so that it's easy to find. If it's a type of provider that maybe a radiologist or a lab bill or an audiologist or optometrist or a DME vendor, on our website, we also have examples of the types of attachments that would accompany the CMS 1500 for each of those types of bills. So again, detailed information about a medical narrative, as well as detailed information regarding other types of attachments. They're all on the workers' compensation website, wcb.ny.gov. And then you would just search on CMS 1500 to find this section of our website that has all this information.
And again, I just want to point out that in the resource slides that we're including in appendices on the slide deck are links to these websites. So you'll be able to see various links that are going to take you directly to these work comp board websites.
Awesome. Thank you both. And then the last question I see here is, how do I partner with an approved XML vendor?
So I can take that question. As Sally mentioned earlier in the presentation, it is very simple to become integrated with CIC. We are an approved XML submission partner to the Work Comp Board, and you can contact us. We've provided the contact information in the slide deck, and it's merely a matter of executing legal agreements and testing the connectivity and determining what data types the receiver can accept or wants to work with. We're extremely flexible and nimble in being able to export bills in a variety of data formats. So we're willing to work with payers to establish the connectivity there. It's just a matter of reaching out and getting the ball rolling, and we'll work with you.
Great, thanks, Fee. And then one more question just came through for you, and that is, if the CMS 1500 form is completed to the work comp board standards, will Carisk automatically kick it back to the providers, or do the payers still need to review and deny as defective?
So the payers are going to have to review. So providers are not going to actually have to change anything in their submission process. We're handling getting all of the information that's required and mapping it appropriately and sending it to the Workers' Compensation Board in XML format as the Work Comp Board prescribed. And this even includes some non-standard data elements such as the provider's Work Comp Board off number and rating code. We're actually able to derive that data directly from the Work Comp Board. So providers don't have to change their submission process. We're handling taking that information, sending it to the payer. The payer does need to provide back the acknowledgement of receipt so that we can then incorporate that in the bill to send a copy of the bill in XML format to the Workers' Comp Board. So it's a tandem submission that's happening. We're getting the data from the providers, we're exporting it to payer and exporting it to board. And then the payer from that point will have to continue with their adjudication process as normal.
Okay, great, thank you. And as I look through, it looks like that is the conclusion of all the questions for now. So thank you everyone for sending those in. And then to wrap up, I'll mention that if you'd like to sign up for future updates from Carisk, you can please email me at paige.grogan@cariskpartners.com, or you can visit our website. And again, your feedback is really important to us, so we ask that you please complete the post-meeting survey that you will receive within the next hour. We'd like to thank Stephanie for being with us today and helping us field the questions and providing her insight. And thank you all for attending this presentation, and we hope you have a great afternoon.